Picture this, an AI that doesn't just say your patient is at risk of sepsis, but tells you exactly what to do. Increase fluids now, recheck vitals in 1 hour. If blood pressure stays low, escalate to ICU. Now, this isn't science fiction. This is what reinforcement learning is bringing into medicine. It's the leap from AI that predicts to AI that acts, and it could change healthcare forever. I'm Dr. Priyanka, physician and founder of MediPocket Cross-Border Care, the world's first physician-led, AI-driven cross-border care concierge company. Now, on this channel, I talk about the future of healthcare, AI, and innovations that are shaping how patients around the world access life-saving treatments. Today, we'll explore what reinforcement learning means for patients, for doctors, for health systems, and for governments, and how we at MediPocket preparing to bring these breakthroughs to real people worldwide. Before we dive deep, make sure to hit subscribe and turn on the bell so you don't miss future episodes. And please share this video with colleagues or friends who are curious about the future of AI in medicine. So, what is reinforcement learning? Unlike most AI models we use today in healthcare, which are predictive, meaning they forecast outcomes, the reinforcement learning is prescriptive. It's designed to learn from trial and error to optimize a sequence of actions over time. Think of it like this. A chess computer doesn't just know one move, it knows a strategy for the entire game. Now, in medicine, reinforcement learning can be that strategist. It can decide based on constant patient data the best sequence of treatments to maximize survival and quality of life. In the ICU, for example, reinforcement learning has been tested for managing sepsis. Now, instead of a doctor juggling dozens of changing variables, the AI recommends step-by-step treatments, learning from thousands of patient histories. Microsoft researchers even use reinforcement learning to identify high-risk states before doctor typically would, potentially buying precious hours for intervention. Beyond ICU care, this technology is being studied in chronic disease management, where dosages and lifestyle intervention must constantly adjust. In oncology, reinforcement learning is being explored for optimizing chemo protocols, and in hospital operations, reinforcement learning has been tested for scheduling surgeries, improving patient flow, and reducing wait times. The numbers are staggering. Studies show reinforcement learning models could cut mortality in certain sepsis simulations by over 20%. Imagine scaling that to millions of ICU patients globally. That's not just incremental change, that's transformative. For patients, this means more personalized care, no more trial and error dosage adjustments, and for doctors, it's decision support in complex scenarios, not replacing expertise, but augmenting it. For hospitals and insurers, it means fewer adverse events and more efficient use of resources. And for governments, it means healthier populations and better controlled costs. Of course, there are big hurdles. Reinforcement learning is only as good as the data it's trained on. If the data is biased, say mostly from Western hospitals, the AI may not generalize well to patients in India, Africa, or Middle East. There are also safety concerns. How do you test a model that learned by trial and error when patient lives are at stake? Regulators will demand transparency and human oversight. And then there's the big question of accountability. If an AI makes a harmful recommendation, who's responsible? To say all this, still the future is promising. Researchers are working on safer offline training, federated learning that protects patient privacy, and an explainable reinforcement learning systems where doctors can understand the why behind each recommendations. Over the next 5 to 10 years, we likely see reinforcement learning integrated into clinical decision support systems in hospitals worldwide. And this is where MediPocket comes in. Right now, our DocAI helps patients worldwide navigate symptoms, upload records, and get matched with the right US specialists and hospital. That's the foundation. But as reinforcement learning matures, we'll be ready to integrate it into our case journey to guide treatment decisions, to to monitor progress across borders and to help governments and insurers manage complex patient populations. Because we already focus on secure global data through our MediVault, we are laying the groundwork to apply reinforcement learning responsibly and equitably, not just for the US, but patients everywhere. So what do you think? Would you trust an AI that doesn't just predict, but actually recommends what your doctor should do next? Drop your thoughts in the comments. To learn more about MediPocket or explore partnership opportunities, check the link in the description. And don't forget to subscribe, share this video, and join me as we explore the technologies shaping the next era of healthcare. Because the future isn't just prediction, it's action.